You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Sylvia Reisman, thank you for being on the Patient Advocacy Now podcast. How you doing today?
Wonderful. Thank you for inviting me, John.
Oh, my pleasure. It's always great to meet new advocates who are out in the field and doing the work and hearing the kind of the stories that come with it. I think, what I've learned so far is that everybody has a different path and a journey as to how they became an advocate. And I'm always fascinated to start there. What brought you to this line of work?
Sure, I'll be happy to share. So originally, I served as an advocate for both my parents. My father was a 5-year survivor of pancreatic cancer. But what really was the driving force for me was that I unfortunately became extremely ill starting back in 2006 when I was living in the Tampa Bay area. And at the time, because I had not lived there but a few years, my challenge was that I didn't really know the doctors in the Tampa Bay area, even though I would still research, along with the fact that I had just a long list of unusual symptoms. And I knew something was horribly wrong because I was always a very athletic, active person, and these symptoms were crazy. And I started going into my conventional in-network physicians and specialists. And literally, I would prepare for the appointments. I was, running from specialist to specialist in the Tampa Bay area and Georgia, Savannah, Atlanta, St. Pete, Sarasota, everywhere. And after about approximately 5 years and 23 plus physicians later, I self-diagnosed and then confirmed with a highly specialized test panel that I actually brought to my then internal medicine doctor in the Tampa Bay area and asked him if he could run the test for me, which he graciously agreed to do. And then when the results came back 3 weeks later, his office gave me a verbal that you're negative. And at that point, after 5 years, and I knew this test was, it was an expensive test, and I just had a feeling. My gut was saying, so I asked for a hard copy of the test results. To me, it looked like I was positive, but I called the lab company in California, and the owner confirmed that I was indeed positive for Lyme disease.
Oh, wow. So they read the results wrong? Your physician did?
He interpreted the results wrong. And let me just say that, first of all, this physician was very nice. He had always, I think he knew something was wrong. I'd seen him for about a year. And I think what happened, because he'd never run this test before, I brought it to him. I think what happened is that he looked at one of the test results within the panel, and he looked at a line that said negative, but he missed the line. The criteria for the lab company in California was different than the criteria for the CDC. So I think that's how he misinterpreted it. And so I did reach out to him. It took me a few weeks to get in touch with him. And of course, it shook him up, and I told him, I said, hey, I just want you to know, because A, I'm not going to see you again because I'd moved back to Savannah. And B, because if you have a patient come along in the future that you decide you want to run this test, that you can reach out to the lab company in California, and the owner will be happy to speak to you and interpret the results for you. So that's because I thought, how many other people is this happening to? So that's what became my driving force to start my practice.
And was it just the diagnose? Like, what happened after that in terms of getting diagnosed? Were you able to treat the Lyme disease from that point?
So what happened was I moved back to Savannah, and then I had some other labs run because I had already been talking to other individuals who had been diagnosed with Lyme in Florida. And I ended up going to New York City to see a Lyme specialist. So I took those results along with, a long list of tests. I had a FedEx box that probably weighed 20, 25 pounds full of my lab results because I wanted him to see everything. And so I started seeing this specialist in New York in 2011, which is when I was formally diagnosed. And he confirmed that along with several other things that typically can come along with Lyme disease. Most people don't just have Lyme disease alone. And seeing that it had gone on for years undiagnosed, it was, of course, a major concern for me. So, so yes, that was the first piece of the puzzle that was diagnosed correctly. There were other pieces that the specialist in New York uncovered. And then actually beyond that, there were other pieces that he wasn't specialized in. So my journey was over 10 years in total in putting this puzzle together.
Wow. And what are the symptoms that, I'm just curious because I don't know much about Lyme disease at all. What were the symptoms that kind of made you go, hey, something's wrong here?
Well, every person's different with Lyme. And so for me, they changed and moved around. So initially, there were flu-like symptoms. And it was in October, which again, it's very warm in Florida in October, but flu-like symptoms. And then I started having neurological issues. Almost anytime I try to sleep day or night, my body would, parts of my body would jerk and prevent me from sleeping. So I literally was a prisoner of war for several years in being unable to sleep day or night.
Oh, wow.
In the first 6 months, I'm trying to look back and think, I remember having night sweats. I remember just feeling horrible, like a truck hit me. But I remember one day and I was trying to sleep and I heard this noise outside and it was like I was sensitive to light and noise. So just a long, like I said, symptoms changed and moved.
Mm-hmm. So what do you specialize in now as an advocate? Because advocacy has a kind of a wide breadth of different things. And I'm sure that your journey and your kind of research led you down a specific service that you do for people or two. What is it that you kind of came into your own in with the advocacy space?
So I have two areas that I'm passionate about. First, of course, is someone who, what I would call a complex case, like me, who there's something wrong and they're running from doctor to doctor and nobody's giving them any answers, or maybe they have been given a diagnosis or multiple diagnoses because of the way our fragmented healthcare system is set up. Each specialist is going to focus on their one organ system. Mm-hmm. So you can walk in and, get a diagnosis from a GI, a gastroenterologist, stomach, and you could end up walking into a neurologist and get another diagnosis. So no one's bringing that together. No one's, because the way our system is set up, no one is looking at what the root cause is within our conventional system. So what I've chosen on the side that I'm passionate about is, again, we have millions of people, and in particular women, although I certainly have helped a man, and some of them are getting, a diagnosis like chronic fatigue, fibromyalgia, even in some cases, MS, Parkinson's, ALS. And again, if they're depending on their situation, they may be questioning it. I mean, I do encourage second and even third opinions depending on the situation. So with the complex group, I developed an in-depth assessment. And that assessment came out, I developed it as a result of what I went through and what I learned, both the mistakes that were made from, again, physicians can't know everything, they're human. And also by following and learning from some of the top functional medicine physicians, although I cannot diagnose, treat, or provide medical advice. It does help me to help my complex clients.
What is functional medicine, since you brought the term up, for the people who aren't familiar with it?
So functional medicine looks to get at the root cause of your symptoms, what's going on, where, many people, of course, including myself for many years, I still have conventional physicians. I have an ear, nose, and throat doctor who's conventional. But conventional medicine, you're taught to look at the symptoms and then, they might prescribe a medication to help with those symptoms, but that's not getting to what's really causing your symptoms. So you could have insomnia, and there's a long list of reasons why you might have insomnia. I'm not against medication. I want to make that clear. There are times that medication is needed, like, for example, blood pressure, if you're diabetic and you can't get your diabetes under control, or in some cases, it might even be temporary. If you might need something temporary to help you sleep until they get the problem worked out. But functional medicine is getting to the root cause, treating that person as a unique individual so that there are tests that can be run that can look and try to get to that root cause versus the conventional way is not. It's looking at symptom relief.
And who practices functional medicine?
Physicians, in general, it's a physician who has been trained conventionally and attended and graduated from a conventional medical school. And then they decide to go back and get, I say certified, it's a certification in functional medicine. And in most cases, or many cases, it's because that physician had something happen either to themselves or someone in their family. Just like I told my story, they have a story. And they realized that the conventional system failed them or their loved ones, and they want to help other people. They know that the root cause is, that's how you diagnose someone correctly and help them.
And is that what you see as one of the biggest issues for patients seeing physicians in the conventional healthcare space today, in the system that we have?
I see it as a major issue because, again, when we're looking at millions of people who are walking around chronically ill, many of them are on medications, and the question is how many of these people have not truly been diagnosed properly and gotten to the root cause of their problem. If we have a system set up that's strictly looking at what are your symptoms, and then in some cases there are conditions they're diagnosed with, but the question is that really a correct diagnosis for many of them? And so it's a problem in that regard, and the time constraint is a huge issue as well in an appointment.
The time, you mean the amount of time that a doctor or a physician is essentially allowed to see you for?
Right, within the conventional system, especially with a hospital healthcare system. Unfortunately, I'm on LinkedIn and I follow a lot of pharmacists, nurses, legal nurses, and physicians. And the talk is, so many of the nurses and the physicians are extremely unhappy. We've had many of the major hospital healthcare systems that have been purchased by large, private equity firms. And so what's happening is these physicians and nurses are being, I empathize with their situation. They, in many cases, are being told you must see an unrealistic number of patients in a day. If you're told you must see 60 patients in a day, what does that translate to as far as quality patient care? And how does that make that physician feel who went to medical school to help patients? And they're not able to. It's a horrible situation. And many of them can't even go to what we call in the hospital system corporate compliance, where you could go and say, hey, I see something unethical going on, because they fear there could be retaliation. So it's really a bad situation.
And so I would assume that functional medicine takes more time to do that deep dive and do those tests. And so that's why it's not practiced more in the system we have today in the United States. Is that what you're kind of getting at?
Well, I think there's a couple of things I want to touch on. One is that functional medicine, for the most part, is out of network. And that's where I think a lot of people have a tough time with saying, hey, I have an insurance plan. Why should I go out of network? That's expensive. And here's the thing. People have to understand that, number one, we as consumers, we are not the customer of the insurance company. We're not. It's the doctors who sign the contracts with the insurance company. And even the doctors who sign the contracts to be an in-network provider they're unhappy because they're dealing with reimbursement issues. They're very unhappy. So I think that that's the first thing people need to understand. And that when you are complex, that you really have to have an open mind at this point to realize that you are probably going to need to go outside of your health insurance plan to get the quality care that you need. Functional medicine, they do spend more time with the patients. Part of the reason why many of them are out of network is because they would be micromanaged by the insurance company. They wouldn't be able to help their patients as they feel they need to.
Got it. Do you see typical, when you call it complex cases, do you see the same illnesses or disorders or something that keep popping up again and again, or do you find that this kind of leads you down weird winding paths?
I think it's all different paths. I just helped someone recently. I actually met her on LinkedIn, and she had been misdiagnosed for at least a year and been suffering, and is a very active person. And she was very open. She let me share her story on LinkedIn, and said, please share it because I want people to know. But she actually turned out she had Lyme disease. She had been misdiagnosed with Ramsay-Hunt syndrome, which is a neurological condition that was on the side of her face. Shingles, it actually worked her way into her gums, where she had gum grafting surgery about a month ago. So, but I do see, I've helped individuals who had pre-existing brain injury, who were on medication for years, and then all of a sudden they start having issues. So, yeah, it's really a wide array of complex.
Yeah, that makes sense. I mean, I guess that's why there's a whole field, because you have to kind of do the detective work.
Exactly.
Would I there's a bit of a long shot, but did you ever see the show House MD?
Oh, yeah.
Is that kind of what functional medicine is? It's someone who kind of plays that detective role?
Well, some functional medicine doctors have used that term, they're the detective. I mean, I actually have used that term for myself, but I'm not a physician and I can't diagnose or treat.
Mm-hmm.
I would say, we look at House, it was a major medical university, which, gosh, if every complex case could have access to that, plus the whole, mentality of them digging, to me, that was somewhat. They did not tout themselves in House as being functional medicine. But when you look at they were really trying to get to the root cause, that's what it appeared to be,
Mm-hmm.
A whole team of people. And that's really what somebody complex needs. When you're just going into these individual specialist offices, the doctors aren't talking to each other. And that's part of the problem in the convention system. They're not communicating with each other. So who's putting together that puzzle for that patient? And that's why my in-depth assessment, it looks to identify areas that have been overlooked due to the fact that, we have time constraints, like I mentioned earlier, with appointments. And on top of that, many of the conventional physicians are not trained on how to diagnose a complex illness. And then we also had testing issues. For example, with Lyme disease, the conventional testing for Lyme disease is 50% false negative. So that means if you thought you had Lyme disease right now and you were able to get a doctor to run the tests for you and you came back negative, that doesn't mean you're negative. But many patients will believe they're negative and walk out.
Wow.
And then the rest of their life, they end up chronically ill.
What's the landscape like as an advocate navigating through the hospital system now? Are you networking with other advocates? Kind of where do you see this new kind of emerging field that's still in its infancy kind of evolving?
Great question, John. So first of all, I want to clarify right now that with my practice, my focus is on outpatient navigation, meaning to the physician's office. So, but I will say that I do network with other advocates for sure in other states because I can help people virtually, and many other advocates can as well. And there are many of us that have different specialties and areas of expertise. So, but I will say that just from what I know, from what I mentioned earlier, from, having conversations with physicians and pharmacists and nurses on LinkedIn, the landscape is ugly at the hospital level. That's why part of what I do is I want to prevent my clients from ending up in the hospital. And we can't totally prevent that from happening. But if you have a good physician, primary care physician from the get-go, and you have a good advocate who's there to help you prepare for the appointments, attend, whether it's virtually telehealth or in person, and they know what questions to ask, and, based on that client's goals, then, a good advocate can help prevent that from happening if the client is managed correctly. And, that's the other side of what I do, is working with seniors or people who live alone who, they're not happy with their current, patient experience. Many people are uncomfortable, intimidated, maybe come from the old school. You don't ask questions. Just, if you're an introvert, it would be very hard to be able to ask questions. I mean, these are, there's various reasons. Or they might have an adult child in another state, and that adult child may be concerned about their loved one. Or the adult child is living locally and they're just too busy with life, but they want somebody to help them with their loved one, navigate to the doctor's office and help keep them, for example, from being overprescribed, which is a common issue.
Yeah. I mean, especially if you think of, seeing 60 patients in a day, you have a very narrow window. So to be able to authoritatively kind of go in and say, I want to talk about this, and this, and I don't want to miss anything, and I want to make sure we address different things. You have to have a pretty organized strategy when going to see your physician, it sounds like.
Absolutely. I did it for years before I became an advocate. So I know. I mean, I basically, put together, I call it, you need to compare it to preparing for a business meeting, and when I started seeing the specialist in New York, I mean, I would prepare for at least 2 hours before I had an appointment with him, whether it was on the phone or if I flew to New York. And he always had a lot of homework for me. So we joke with each other, but it's really, if somebody's really, wanting to regain their quality of life, because this is what happens, it's usually people who are, on the side of the complex side, someone who may have been extremely active, athletic, and all of a sudden they're just, their life's just overnight has changed. Individuals who've lost their quality of life and they want it back, I can attest that I would do anything to get my quality of life back, as long as, I had the right physician. And if I had known somebody like me 15 plus years ago, I would have been all over it.
Yeah, absolutely. I have a question for you. So we've talked about complex case. Another word I think you've used in the past that I remember hearing was invisibly ill. How would you even define that? So how do you know? Because a lot of people are saying, well, I just feel flu-like symptoms. So what makes a case a complex case?
Great question, John. So when we talk about invisibly ill, and again, we have millions of people who are invisibly ill. There's a wide range. It could be someone who, again, let's say I mentioned it earlier, chronic fatigue. Does someone with chronic fatigue look sick? No. They might even get compliments on how great they look. Does someone with fibromyalgia look sick? No. Does someone with lupus look sick? Probably not. So, we have a wide array of illnesses, that individuals, and again, that's a whole nother story I could get on for those people who are invisibly ill, who are out there advocating so that people understand that they are really ill and that it affects them emotionally, physically, emotionally, a gamut. It affects the relationships, everything. So yeah, it's a wide array.
So I guess my question, I'll rephrase it a little. I think that was a good answer, but I didn't quite ask it the way I wanted to. Let's say you're suffering. How can you know that you should be exploring this concept of, hey, maybe there's something deeper going on?
Okay. So, if you know, because your gut's telling you, your body better than anybody else. If you know something's not right and your life's changed and you're starting out going to your, in-network primary care, and like I said, you end up being referred on, here's the red flags, though. Red flags as far as when you go, if you're not treated seriously, if you're able to convey specifically your symptoms, how long they've been going on, how your quality of life has changed, rate yourself, 1 to 10, 10 being the worst on all these different areas. And then you're going in and sitting down and talking to your doctor and having these conversations. And if they're not taking you seriously, if they are saying, hey, it's just stress, it's just anxiety, it's all in your head, the red flags should be going off that you need to fire somebody. And you need to think about retaining a knowledgeable patient advocate, because if you're sick and you're not feeling well and you're visibly ill, whether visibly or not, you're probably not up to be your own advocate, even though I actually, conduct presentations on how to be your own advocate. But you have to look and realize that, hey, I'm too sick. I need somebody to help me, navigate this system.
Yeah, absolutely. You mentioned Lyme disease a couple times, and you also kind of in passing said you were on LinkedIn. I noticed some people biting into limes. Is that an awareness kind of campaign, or what's going on? I wish I paid more attention, but while I have you, and it might just be another kind of millennial kind of fun, weird thing they're doing, but I thought I'd ask if there is any relation.
Sure. So yes, I absolutely know about it. So back in 2015, I was with a group of individuals. All of us had been diagnosed with Lyme, and or family members had, and we decided that we wanted to collaborate on executing a global social media campaign to provide the facts to the public on Lyme disease, because there is a lot of misinformation. And so a lot of people don't know that. So we were on Instagram, Twitter, Facebook. And we, back in 2015, we started, and we didn't know what would happen. We started, I think, in March of 2015, and it was the most exciting campaign I have ever been involved in. I was on Twitter tweeting to celebrities, the media, public figures. And so basically, it was kind of like the ice bucket challenge, where you would take a bite out of a lime and you'd state 3 facts, and then you challenge 3 people or organizations. So we did this for about 3 or 4 years. And May is Lyme Disease Awareness Month. So I brought the Lyme Disease Challenge to LinkedIn for the month of May to provide awareness. But at the same time, that's how I mentioned earlier, the woman who connected with me. So a lot of, even I've even had a physician in Canada who I've Zoomed with. She's an engineer and a nephrologist, which is a kidney specialist. She reached out to me. She and I have spoken many times, but she was like, wow, Sylvia, you are a wealth of information. So her daughter was bitten by something. And so it made her really think, like, I need to make sure that my daughter was not bitten by a tick and that she doesn't have Lyme.
I remember seeing something on like a TikTok of someone treating Lyme disease with bee stings. Is that a form of treatment that you've ever heard of?
I've heard of it, but I don't. Again, I can't diagnose or treat, but I don't support that personally. Okay. I have heard of it.
It shows you like what kind of vast array of knowledge is out there. Is like some people are treating it with things where you're like, oh, that sounds a little risky,
I've heard of that, and and the sad part is, because a lot of people do become very desperate because they've been sick a long time, and I'm very empathetic about this, but there might be some, I say doctors, I don't know if it's naturopathic or I don't want to say because I don't know, but I do know they're hearing some of this stuff from somewhere. But I would be concerned about something like that. Yeah. Okay.
So the answer is get a qualified individual that you trust, who has a good track record to
absolutely
get a course that actually has some evidence base to it and that you can believe in, right? Okay.
Right. And again, that's part of my service. If someone comes to me and they they end up taking my in-depth assessment, and then I create, a plan of action from that, as well as provide them with the findings from the assessment and their detailed timeline, their history. They have the choice that they can either continue on with me, or I can help them research for physicians and, like I said, attend the appointments virtually or in person. Or they can take that information out on their own if they want to search on their own. And then if they can't and they just realize they need more help, then they can come back to me.
Yeah, it makes perfect sense. If someone does want to work with you directly, is the best place to find you on LinkedIn or to your website? What's the best way for them to reach out?
Well, there's a number of ways. One would be LinkedIn, which I'm on Sylvia Reisman. And they can also, my website is Purity Patient Advocates with an S on the end.com. I'm also on Facebook, which it's Purity Patient Advocates, LLC on Facebook. I'm on Instagram, which is at Purity Patient Advocates with an S on the end.
Okay. Lots of options, kind of most of the major social media platforms covered. And the website for the old school web surfers, it's puritypatientadvocates.com. Did I get that right?
Correct.
Okay.
That is correct.
Well, Sylvia Reisman, thank you so much again for being here. I appreciate sharing all the wisdom and keep fighting the good fight and helping people.
Thank you, John. Thank you so much for having me.